So we have a challenge of feeling unsafe in our communities. We spent the last 8 days talking about police presence and the need for increased police presence in our communities. This is a segue, perfect time to segue into the other component of feeling safe in our communities, which is the need for a mobile crisis unit. Now, I want to first of all explain what that is. The Mayor of St. Andrews, Brad Henderson, has directly asked the Minister of Public Safety if we can have a mobile crisis unit in Saint Croix in our region to partner with the RCMP on calls that they get. And there is still no answer, as far as I know, no answer that's been made public. As your MLA, I will be on this like, insert analogy here, uh, a dog on a bone, because I do believe that this is key when I'm looking at the data of pilot projects or studies that are done where a mobile crisis unit is working in tandem with police officers to get people the help that they need. So I'm going to spend the next couple of days unpacking that with you. Today, let's just talk about what a mobile crisis unit is. A mobile crisis unit is provided by the healthcare authority, the health authority, Horizon or Vitalité, one of those two in New Brunswick. If you've been watching my videos at all, especially the healthcare, number three, getting a community health center in our province, you know that those are the health authorities. And so they provide mobile crisis units, which essentially is a social worker or a trained nurse. They're both trained in crisis response, and they are dispatched to a community to be called and work with a police officer, specifically in the areas where we're seeing these studies or these pilot projects. They're paired with an officer, and they actually go to calls where the officer deems the person as the subject of that call to be in mental distress, a mental health crisis of some sort. And the numbers are staggeringly encouraging and give us reason for huge optimism in terms of this is a solution to the problem we've been talking about for 8 days. Is the police are under resourced, there are not enough officers. And did you know that a lot of the reason for that is their time is taken up with mental health distress calls. St. John, for example, saw a 40% increase in mental distress and mental health related calls to the police since the pandemic. 40% more. So officers are responding to these situations, and we have seen sometimes with tragic results. We have seen people getting shot by officers when those officers don't feel safe. They're not able to de escalate the situation. But there is hard data to show that when an officer is accompanied by a mental health, a mobile crisis unit agent, essentially that trained social worker or nurse, the situation resolves in incredibly positive ways. For example, 83% of all the calls studied over a 3 year period where the officer and the mobile health unit person accompanied the officer, 83% of them were resolved in the community, which meant that the officer did not have to drive the person out to the hospital. So when there is no mobile health unit, when there is no mental health agent with the officer, they will simply arrest and detain the person, then often bring them to the hospital. And what one study saw was that the number of hours that the RCMP spent in the hospital with someone in mental health distress, it decreased from 80 hours a month to an average of 20 hours a month. So the police are spending so much time in the hospital with individuals who they detain. And what we are seeing as a part of our need for more officers visible and working and responding to calls, especially if we're not getting any more officers, we're only getting one more over the next 2 years in St. Croix, is we need to see these mobile crisis units move out of the cities and move into the rural areas. So I'm with Mayor Henderson when I say we absolutely need that kind of service in our region, not just the cities. I would really like to, and I would start appealing as your MLA, to have a mobile crisis unit in Saint Croix to accompany officers, and so that we can get all the benefits we're seeing, benefits of the officers, benefits of the person being detained. Friends, in a nutshell, with my last 0 seconds left, I want to reiterate that addiction is a health issue. Addiction is defined as a disease or a disorder. It changes the brain, it changes somebody's wiring, their neurological pathways. We need to be responding to addiction, drug addiction, people in addictive distress or psychosis or hallucinating as a result of substance abuse out there on the street. There's some well-known individuals in St. Stephen who are walking the streets. We need to respond to them in a more positive way than just dispatching the police, putting them down, throwing them in jail, and that kind of thing. They do need health services because addiction is a health issue. And that's why Verité and Horizon are on the right track with these mobile health units. We are seeing the hard numbers, which I'll share with you tomorrow in part 2, about why we absolutely need this expanded outside the major city centers into St. Croix where we don't have enough officers. This is a solution. I read things like this and I get so excited. And then part of me gets slightly discouraged when we have a government who is campaigning on slashing $500 million a year from our budget, saying they're going to cut the sales tax by 2%, when the solutions and the projects and the pilot projects and the initiatives for making life better in New Brunswick are right there. And we have the surpluses, we have the increased economic activity. This is not the time to cut all these budgets and see these services rolled back. We can do these things together and feel safer in our community. And these incredible folks who are working on the mobile crisis units in the cities, we need that expanded out to our rural area. Talk more.